Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain. Hey everyone, I'm here with Dr. Ben Weitz. He is a functional medicine practitioner. His focus is on gut health and autoimmunity, and I have him on the podcast here to talk about those subjects. He also has his own podcast, which I was on, and I remember that he was quite knowledgeable, so I invited him on mine. And yeah, I want to get his take on how he practices functional medicine, what he uses, what's his process, and how he is able to heal gut health and autoimmune conditions. So thanks for coming on, Ben.
Thanks for having me on, Joe.
Did I miss anything from your resume?
That's fine. That's fine. Yeah, I've been in practice for 37 years. I did write a book a number of years ago called the Back Relief Book. I've published a few papers, and I'm really passionate about functional medicine. And I also organize a monthly functional medicine discussion group meeting where we bring in speakers, and we usually film that as well.
Okay. So what's your view of functional medicine? What do you think functional medicine is? That term gets thrown around a lot. I feel like, what do you define as functional medicine?
I define functional medicine as having a focus on the root causes of problems rather than just treating symptoms, and with a focus on diet, lifestyle, exercise as the foundations of sleep, as the foundations of that program, in addition to targeted nutritional supplements.
Okay. So that makes sense. And when you talk about the root cause, are you talking about the root lifestyle causes, or the root biochemical causes?
Let me give you an example. One of the most common gastrointestinal conditions is irritable bowel syndrome, or IBS. Patients typically have gas, bloating, stomach pain, diarrhea, constipation, etc. And for many years, this condition was treated as a condition of unknown origin, because when you put a scope, either from the bottom up or from the top down, you can't see anything. So it doesn't look like there's any structural cause of it. And so for many years, this was treated by treating the symptoms. If you have constipation, here's a drug that treats the constipation. If you have diarrhea, here's a drug that reduces the diarrhea. If you have stomach pain, here's a drug that reduces the stomach pain. And then, of course, because IBS was way more common in women, and we know that women tend to be emotionally unstable, let's use antidepressants, because we know stress is the main problem with every disease. And so basically it was a lunch bucket diagnosis, put a bunch of symptoms together, and let's treat the symptoms. But now we recognize that IBS, in the majority of cases, is caused by a functional imbalance in the gut microbiome. There's an overgrowth of bacteria in the small intestine. We now have ways to test for it. We have a SIBO breath test, and we can also get some evidence from looking at a stool test in terms of the function of the gut. And then we can try to correct the underlying root cause, which is reducing the bacterial overgrowth, getting the gut function to be improved, which will eventually alleviate the symptoms. But in that way, we're focused on the cause rather than just treating the symptoms.
I see. Okay. But I guess there could be multiple things when we talk about the root cause, though, right? There's biochemically, what is the root cause, where you go into different biochemical pathways. For example, you say, methylation, that's a biochemical pathway, or that you could focus on, especially specific parts of that pathway. You could say there's a problem with a certain biochemical pathway, and that you could say that is a root cause of some issue. Or you could say, like you said, there's some pathogenic imbalance, if you will. Usually I would say there's some external variable, right? In this case, there's an imbalance in pathogens. It could be some kind of toxin imbalance. But basically and then the other thing is, I would say that, I don't know, the specific case that you mentioned doesn't fit with the two that I mentioned before, which is, one is a lifestyle original cause, or an environmental/lifestyle. So like you were exposed to some toxin, This is like, in terms of, you're using an example of a root cause as there's a microbial imbalance in the gut. I wouldn't call that biochemical or environmental.
Okay,
Yeah.
why don't we look at another set of conditions? You mentioned autoimmune diseases. So, what's the difference between functional medicine and conventional medicine as to the treatment of autoimmune diseases? So,
Okay.
in autoimmune diseases, of which there are over 100 different conditions and many more conditions that at least have an autoimmune component, including cardiovascular disease. So, in these conditions, the immune system is attacking your own cells and tissues, whereas your immune system is designed to attack outsiders, pathogens, viruses, bacteria, toxins, things that come into your body from the outside. In one of these conditions, there's some sort of confusion, and so your immune system is attacking itself. Say
Right.
rheumatoid arthritis. In this case, your immune system is attacking connective tissue in your joints. So
Sure.
the conventional approach is we have this immune system, we're just going to block it. And we don't know why the immune system is imbalanced. We don't care. We know that's the mechanism that's leading to destruction of joint tissue. So we're going to use TNF blocking agents. We use other drugs that modulate the immune system, down-regulate part of the immune system, and therefore there'll be less attack on the joints. From a functional medicine perspective, we want to say our bodies are obviously not designed to attack ourselves. So what's gone wrong? Let's try to find some of the underlying causes. And there doesn't have to be just one cause. There can be multiple causes. Our bodies are very complex systems that work together. So among the possible causes of immune system dysregulation, we'll just call it that, are food sensitivities, toxins, chronic infections like chronic viral infections, gut microbiome imbalances. So let's say, for example, you have a food sensitivity to gluten, and now the immune system is attacking gluten, and then it creates antibodies to gluten. And those antibodies then recognize structural proteins in your joints that are similar enough to the gluten protein that we have what is called cross-reactivity. And so therefore they attack the joints. So in this case, we would want to put the person, first we would want to determine that gluten sensitivity was an issue. And B, we would want to put the person on a diet that reduces gluten intake.
Okay. So these are the environmental / lifestyle factors that are contributing to an issue. That's what you mean by root cause, in terms of, let's find the environmental / lifestyle factors.
Yeah, I said root cause rather than just cause, because the cause of autoimmune disease is that the immune system's dysregulated. But we want to ask an additional question. Why is it dysregulated? Our bodies are not designed to attack ourselves. So something's gone wrong. Let's try to find some of the underlying causes and let's reduce those. And if we can reduce enough of those, we should be able to get the immune system to calm down.
Okay. So what do you typically do for a case where you have autoimmune issues? Like, what do you find works what's the number one root cause or environmental cause?
I try to approach every case individually. And that's why we start with a very detailed, careful history. We
Okay.
want to go through their history, learn about how they grew up. Were they breastfed? Did they have a lot of infections when they were young? Are they likely to have an imbalanced microbiome? Did they have exposure to toxins? Is it likely that they might have, based on where they lived or where they worked, et cetera, et cetera? Do they know of mold in their homes or offices? Do they know did they have a lot of mercury amalgam fillings? Did they eat a lot of tuna fish? Various reasons why they might have toxins or other environmental issues. And then we try to use testing to go down, confirm what we think might be the case.
Okay.
So, for
I
example,
see.
I'm going to tell you about a patient. We're not going to talk about her name or anything, but severe eczema for her whole life and just unbelievable skin just horrendous, and tried all the leading drugs. And for the most part, they didn't work. Sometimes they worked for a little bit, stopped working. She came to see me. And so we decided that based on history, the most likely things that might be involved would be gut imbalances and food sensitivities.
Yeah, I
So
think that's probably the case in most cases of eczema. Would you agree with that?
I think it's common. Yep.
Okay.
Yeah, I would agree with that. It turned out that her highest food sensitivity was almonds, which is a food that she loves eating a lot. And
Okay.
so we took her off of about 8 different foods, and then we're going to test them back other than wheat and the almonds. And
Okay.
in a month, she's feeling the best she's felt in years. Her skin is better, her energy's better, all the things she came to see me for. Now, some of that could be placebo, but so far, we seem like we're getting some results. And we also tested her gut with stool testing, and we saw a microbiome imbalance. Their issue is leaky gut. If patients have leaky gut, they're more likely to react to a lot more foods.
Okay. I would assume that's true. Yeah, definitely.
Maybe
That seems to be
maybe you
true.
don't believe in leaky gut. I don't know what you
No,
believe in.
I do believe
But
in leaky gut actually.
okay,
I believe in leaky gut. I guess there's some vagueness around some meaning like there's a lot of scientific literature that clearly speaks about leaky gut, intestinal permeability, they'll call it. The question then is how prevalent is it? That's a question I don't know. If you ask Dr. Gundry, he's going to be like 99.9%. And the question is, how severe does it have to be? Meaning everybody's gut is leaky on some level, I think. So the question, and then the third question is, how legitimate are these tests that are checking for leaky gut? And in terms of outcomes, right? Because you want to see outcomes. You want to see,
of course.
okay, not only is what you're measuring being measured, that's what these labs are proving. You want to see that, hey, there's a clinical, if this says this, then you should do this. If this says that, then you should do that.
Sure.
I'll give you an example. So a lot of these tests I'm unsure about, and some of them I
Okay.
have an opinion of one way or another.
Okay.
But I'm not 100% convinced. It's just that's my leaning.
Okay.
Recently, I've been looking into the Genova organic acids test. That's like the holy grail of pretty much every functional medicine person I know uses that. And I would say that my impression of how I'm leaning is I think it's a little bit of a complex question because they're checking for certain things that are legitimate and that you could find things, right? Maybe 10% of the test. And I think their whole interpretation is garbage. And yeah, the question then is, I don't know, like what can you exactly get from it? I don't know. Maybe we can talk about that. Are you well versed on the organic acids test?
It's not the test I use the most, but I sometimes include organic acids.
Okay, I could tell you my experience with it. So my experience is, and I could even show you my results. I'm curious what you think about it. But my experience is basically that all the things they told me I was deficient on, I know for a fact I wasn't deficient on. And I also know that the way they made those determinations, it's very clear how they made those determinations of what I'm deficient in. It's based on the amino acid consumption. So basically, they assume that if you have more of a metabolite of a certain amino acid, these metabolites are mostly metabolites of amino acids. And if you take a lot more of an amino acid, they basically will make an assumption that you're deficient on something because they're not the fundamental problem with that test in terms of their interpretation is they're not controlling for your level of protein consumption or supplemental protein. So if you have a high protein diet versus a low protein diet, your results will be completely different just based on the amount of protein you're consuming. That's my biggest problem with that test.
Okay.
What do you think about that?
I really haven't spent all that much time on organic acids, but I have used the Nutri Eval, which includes an organic acids part of it. And
That's the one I did, the NutriVal.
Yeah. I know for me, that test was really helpful. I tested my biggest deficiency was zinc. I also had my genetics done, and I have genetic reasons why I don't utilize zinc. And I
Okay.
also have autoimmune thyroid, Hashimoto's, and I've been managing it without taking medication for many years. And increasing my zinc intake was really beneficial for me. And I was already taking what I thought was a reasonable amount of zinc, but I realized for me, based on my genetics and based on the outcome of that test, that I wasn't utilizing it and I needed more zinc.
Okay. And how much were you taking before?
I was taking 40 milligrams of zinc, like 10 in my multi and another 30 supplementally.
And that wasn't enough?
It wasn't enough for me.
Whoa. And what did you determine that based on?
I just told you, I did the genetic test. It showed that I'm not utilizing zinc. I took my 23andMe raw data and put it into some software. And then I tested as deficient in zinc on the Nutri-Eval test. And then subsequently, I've also looked at my serum zinc and copper levels. And my zinc.
And what's your serum zinc levels?
It's always on the lower end of the normal range. Like the normal range is between 0.5 and 1.0. And so mine is typically like 0.6, 0.7, something like that. So I keep pushing it.
Even with the 40 milligrams a day or
Yep.
50 milligrams a day?
Yep.
That's unbelievable.
We all have different metabolisms, and what's
Right.
good for one person is not for another person. That's
Maybe
why
you
I
could
think
check out.
testing can be beneficial.
What would you get from my test here for the Nutrival test here?
What would I get from it?
Yeah, if I have, would you be able to look at this now on the screen share and be able to see what would you look at in this test? That's what I want to understand. So here, this interpretation at a need, these are interpretations.
Right.
Oh, this is B vitamin needs. You see how I'm like number 10 means this is I need a
You have the
serious.
greatest need for B vitamins.
Right. Now, the thing is that I take a large dosage of B vitamins, and I'm pretty damn
How
sure.
much you take?
B1, I take 100 milligrams a day when I was taking this test.
Okay.
B6, I was taking 75 milligrams a day.
Okay.
P5P. Biotin, I was taking 3 milligrams. I was taking high. My serum levels are very high. And
Okay.
I'm someone, by the way, if I'm taking 5 milligrams of B1, I've noticed a big difference between 5 and 25. And so I could feel, hey, I need more B vitamins. However, between taking 100 milligrams and at this stage, just taking more B1 is not going to do anything for me, right? And the thing is, it gives me a 10 on my, and I know why it's doing it. It's doing it because there's a later section that shows maybe some reasoning, and basically it's because of the amino acid consumption. So all these results here for the B vitamins are all wrong. So I just decided to look up this one in particular, the one that Figlu, right? And what amino acids increase metabolite, right? So it is a metabolite that results in the breakdown of histidine. So number one is if I was supplementing with histidine, and also if you just eat more amino acids, you're going to have more histidine. Figlu is primarily derived from histidine through a metabolic process known as the histidine catabolism pathway. Histidine is converted into Figlu via the action of histidase, and this pathway is linked to folate metabolism. Increased histidine intake or availability can lead to higher Figlu production, and then not only are you going to produce more, you're obviously going to urinate out more likely. Now, so it is related to folate in some way, but actually most directly it's just going to be related to how much histidine you consume. That's my biggest problem with this. So now, yes, if we're able to look at exactly.
But it also depends on how you metabolize the histidine, correct?
Yes. So there's going to be a number of factors. Number one is what's going on is, okay, so number one is how much histidine are you consuming, either from supplements or diet? That's the biggest factor, I think. Number two would be how much, meaning I assume if you have enough of these, so if you have enough folate, you're going to convert more histidine to this metabolite of histidine, right? It's as a cofactor. But then what happens after that, there's other factors that will determine how much you pee out. And again, I'm not sure what all those factors are, but the idea is that you could also have just higher levels in the serum, or your body could decide to pee it out. There's definitely going to be a correlation between how much histidine you consume and how much you're going to pee out. But basically what I'm saying is that there's a number of factors that are going on here, and they're taking one factor, which is folate, but they're not accounting for the variability in histidine consumption, which basically in my mind makes it a very inaccurate result. Now, if you were to tell me, hey, look, there's a study showing that people with Figlu urinary output, like higher Figlu urinary output, it is associated with X, Y, and Z conditions. I would say, okay, at least we have that information. Forget about causing it, associations. The problem is we don't even have that data. So it's the way that this test is working is it's going based on biochemistry, assumptions from biochemistry, but they're leaving out some of the core assumptions that you would need. Meaning the assumption is that if you have more folate, you'll have more figlu in your urine, okay? Which could be valid. Maybe yes, maybe not, right? Let's say I'm leaning towards yes. The problem is that it doesn't look at all the other factors related to it, which is the biggest one would be how much histidine you're actually consuming, which I think would be the number one factor. And basically, that same logical error repeats itself within this whole test. Like I said, 90% of these are going to be like in large part determined by how much amino acids you're consuming. And then the other aspect of it is there's other aspects to the equation.
But you can cross-check it with other things. You can look at homocysteine levels. You can look at other markers of functional folate, B6, B12 status.
Yeah, I would agree with what you're saying. I would say that for most of these, there's some kind of genetic condition where somebody's does not have the ability to produce a protein or enzyme to convert something to another efficiently. And there's some genetic condition, which is something that they will test. This is what these tests are actually used for in a medical setting. But these are very rare conditions. The way that this is being used is going to be completely different in terms of what you can get from it. So yeah, there's medical condition called that has this issue, but what can you get from a healthy person who has higher, like slightly higher or lower levels of this metabolite? As far as I'm concerned, the only thing I can see based on my results and based on just logic, I would lean towards the only thing that we can see here is just how much histidine you're consuming. That's the number one factor. And again, so I'm not against all functional medicine tests. I just have I have a method into trying to understand them. One is looking at
all of organic acids testing. I get it.
Yeah. Looking at the research and seeing, is there a very specific relationship, even association, preferably causation, preferably some kind of clinical trial. But let's say just an association between some result and some condition. And then,
well, you have to look at each individual person too. If you got somebody in front of you and they're telling you they're taking really high levels of B vitamins and you get a test result like this, maybe you say for that person, I don't think it's reasonable that you necessarily need more B vitamins.
Now, to be clear, I think there's some
the average person is probably not taking vitamin supplements, and it wouldn't be unusual for them to be low in some B vitamins. We know B vitamins are depleted by stress and various medications and smoking and all these other things.
Yeah, the only thing that I would say is that the thing that is very reasonable that changes is the protein consumption. So if you eat more protein, your metabolites are just going to change. How do you control for that variable? That's my only gripe
here. We're looking at whole blood glutathione, so we're not talking about urine metabolism anymore.
Yeah, this is what I would say actually is legit parts. So whole blood glutathione, whole blood ubiquinone. This one, they didn't even get my result. There was a problem with, they said they couldn't process it. Lipid peroxidase in the urine, NR, seems like they couldn't get the result. This one is the 8-hydroxydeoxyguanine in the urine, which is a legitimate test, actually. And I'm saying that because there's scientific studies on it. Now we're seeing like elevated valine, leucine, all these metabolites, again, just because of the increased consumption. My conclusion is that all the urine metabolites.
You can see in your particular case, right, how you have high levels of all these amino acids.
Correct.
But if you had low levels of amino acids, maybe those results would be more significant. So that's the interpretation of these tests.
Yes. And that's a good point in the sense that you could see, okay, my amino acids are all high. But then you really have to, first of all, in their own analysis, they should be taking that into account, which they're not. Meaning they're giving me very bad results based on their analysis, which is clearly too simplistic for what's going on here. They should have understood, hey, we need to take how much leucine this guy's urinating and compare it to how much of the metabolites of leucine he's urinating in order to adjust our recommendation for how much B vitamins he needs, which they didn't do.
Reasonable.
Yeah. which they
Yeah,
didn't
I'll
do.
contact
And
Genova and suggest that they add you as a consultant to their testing.
they should. But the only thing is I don't know what the answer would be. I think you need end user data to understand, okay, if you have the ratio of urinary leucine to a metabolite of leucine, or
Hey,
you
you're
rate, yeah,
making a very valid criticism of this test, and I think that's something that they could reasonably consider in their algorithm is we're looking at these amino acid metabolites in somebody who's consuming a lot of protein or taking a lot of amino acids. We need to adjust how we interpret that.
absolutely. And this one I think is a good one, right? So they're looking at
Omega
RBC,
3s, omega
omega
6s.
3s, on that.
Yeah.
And by the way, this seems to make sense given my intake. So actually, I'm like, yeah, I have high EPA. I was taking a lot of fish oil. This actually
Yeah.
makes a lot of sense, right? Like the stuff that I thought was legitimate actually makes sense. And
But
so,
sometimes somebody takes a fair amount and their levels are not that high. And that's one of the reasons I like to do a certain amount of testing. I haven't been
I
running
agree.
this test too
I agree.
often, but like for me, I have to take more omega 3s than the average person to get my omega 3 index up to a level that I like to see.
And I also do, right? What I noticed is the same thing, is that I need to take probably 3 grams of EPA a day to get my EPA consistently higher because I use up a lot of EPA. So we're on the same page there. I think the omega-3 testing is good. I'm not trying to
So,
shit
the
on
point of these
Genova as a
testing is
whole.
just to
Yeah.
try to see how well we're absorbing these various nutrients because we all have different metabolisms and we all have different environmental stresses. And so we're trying to
Yeah.
individualize care.
Yeah, and I would say this one here with the toxic elements is probably accurate in my case, meaning I come up low in the past few years every time I do a blood test for heavy metals. These come up as, I think these are reasonable ones. Again, these are blood. So you could see selenium, zinc, potassium. I'm normal for all these in the blood, which makes sense because I
Yeah.
do test them in other places and
Yeah. For
in general.
micronutrient
Yeah.
status, I tend to use serum testing and I usually use the micronutrient test that compares serum levels along with white blood cell or red blood cell levels, since white blood cells and red blood cells turn over approximately every 90 days. So it gives you a little longer term picture.
Okay. In terms of what other testing are you doing?
We like to do stool testing when
And
we
what are you
want
looking
to
for
look
in a
at the
stool
gut.
test?
We're looking at the overall balance of the microbiome. Are there pathogens? Is there fungal overgrowth? Is there bacterial pathogens? Are there parasites? And then is there dysbiosis? Is there an overgrowth of certain bacteria? And then let's look at the commensals and how does the microbiome look? Is it really depleted because maybe the person's been taking a lot of antibiotics and hasn't been, and maybe other medications that are depleting their microbiome? So we also get functional measures of their gut status. We look at stool zonulin, which is a marker for leaky gut. On the other hand, I assume most of the patients with gut imbalances probably have some level of leaky gut. We look at pancreatic enzymes to see how well they're producing enzymes that allows them to break down their foods. And if you can break
Pancreatic
down
enzymes in the serum or in the
in the
gut?
stool,
In the stool. Yeah.
yeah,
Okay.
pancreatic elastase levels. And we see if there's a lot of fat in the stool, meaning they're not breaking down their fats. And that can be a problem with either decrease in lipase or bile. And then we're also looking to see if there's inflammation. So there's several markers
Based
for
on what?
inflammation. Fecal calprotectin is one of the most
Okay.
common ones.
So these are actually the things that you're mentioning here are, I think, pretty validated, meaning I would say that these are tested, right? They're used in conditions with gut inflammation, right?
Yes.
Have you ever seen a stool test that was like completely great?
Some are pretty good, and then nobody's perfect on anything, I don't think. But yeah, some stool tests look really good, and some people just look at various levels. Some people just have a lot of overgrowth and bad actors, and some people have a really depleted commensal picture, and that can be equally problematic.
How much does one of these stool tests cost?
Approximately $400.
$400. Do you do amino acid serum testing ever?
You can do that through Genova as well, but typically I don't do amino acid testing. Actually, when I do the micronutrient test, there's amino acids involved.
Oh, okay. I see what you're saying. So that they're
Yeah.
checking for serum.
Yeah.
What kind of micronutrient testing are you checking for? What kind of test do you do there?
We're using a Vibrant micronutrient test
And what are they using? Are they using serum, plasma, or like
and either red blood
intracellular?
cells or white blood cells.
Okay.
Gives
I
you
think those
shorter
are
term,
valid
longer
tests.
term.
Yeah.
And they also look at fatty acids, and we're looking at amino acids and a bunch of phytonutrients as well. Other nutrients,
Okay.
like CoQ10, L-carnitine, et cetera, et
So
cetera.
I think those are legitimate ones, right? So you're looking number one, and like I said, I think there's a lot of good to functional medicine. So for example, I think the stool test seems like a good test where you're measuring valid stuff, right? The micronutrient testing seems like a good test. There's some things in the NutriVal that were legitimate. What else are you testing for? Like what other tests do you typically do?
Well, like for a patient who has autoimmune disease, like I said, it depends on what we're suspecting. If we're worried about toxins, we might look at toxins either through serum or urine. We might look at heavy metals. We might look at environmental toxins. We might look at ecotoxins. We might want to look at a viral antibody panel if we think that there's possibility that they have some chronic stealth infection like Epstein-Barr or something like that.
I would like to go into the mycotoxin one. This one, I'm neither here nor there. No, I'm in the middle. I have no leaning yet. Do you find that anybody has like low levels of mycotoxins in the blood?
Not everybody has high levels.
Okay. Have you done that test on yourself?
I have not.
Okay. My next tests are actually going to be try to get these mycotoxin tests done on myself.
By the way, there are mycotoxins present in food, and some of the results of these tests could be indicating what's coming from food. That still doesn't mean that the mycotoxins aren't necessarily having an effect on your health.
That's true. So which mycotoxin test are you doing? Which company?
So we're either doing Mosaic or we're doing Vibrant.
Okay. Do you do hair mineral tests ever?
I don't.
Okay. I also am not sure what I think about those, but I mean, I'm in the middle. I did one, and it basically said I had enough minerals of everything. So I'm not able to like. Okay, it seems like it's accurate. I think I'm pretty well stocked on minerals. It seems like it's accurate in my case, but who knows? But for the mycotoxin one, I want to take.
By the way, anytime I do a test, it's to confirm or show that I'm wrong about things I'm already suspecting.
That makes sense. Okay, so what do you once you find? I guess you're finding the root cause. You're finding a food sensitivity. So you find which foods are you mainly doing an elimination, or you're trying to also create tolerance in the gut?
We're trying to create a healthier microbiome imbalance and create tolerance and reduce leaky gut as well.
Okay, so what are your top recommendations for doing that?
Depends what we see on testing. So if there's a lot of overgrowth, if there's a lot of bad actors, infections, candida overgrowth, we use various combinations of herbs to reduce the overgrowth. And then we use combinations of prebiotics, probiotics, postbiotics, fiber, etc., gut healing nutrients, L-glutamine, various herbs to try to heal the gut.
How much L-glutamine are you giving typically?
Typically 5 grams a couple of times a day as part of a gut healing formula.
Okay. And what do you find is some of the top gut healing stuff in terms of closing leaky gut?
Like I said, probiotics, prebiotics, and it depends on the person. And we try to get a sense of what they're probably going to need the most. But the right types of prebiotics, which are various forms of fiber, and as well as there's a bunch of mucolytic herbs like slippery elm and marshmallow, etc., that are usually included in these formulas. So we'll use some sort of combination product that has glutamine and some of these other herbs and healing nutrients. Sometimes we'll add in curcumin as an anti-inflammatory.
Okay. And you find that if you close the leaky gut and if you stay away from foods that somebody's sensitive to, typically the autoimmune stuff goes away?
Depends on the person.
if they don't
We
have
have to
another
address other
factor,
things. Yeah.
like mold? How common is mold as a factor?
I don't really know. I can't give you any statistics on that.
What's your gut hunch feeling?
I don't know. I think there's a lot of mold in the environment, but a lot of people are not necessarily sensitive to it.
Okay. What about what's your hunch on how much of it is related to infections?
How much mold is related to,
No, how much autoimmunity is related to infections?
to chronic infections?
Yeah,
I think chronic infections are probably more common than we realize. For
I
example,
would
we
agree
know
with that.
that COVID, long COVID, one of the important factors is it tends to reactivate other chronic infections, specifically Epstein-Barr, HSV.
Yeah. No, I've come to that conclusion as well, that infections are more chronic infections are more problematic in terms of causing a bunch of different conditions, especially autoimmune conditions.
And a lot of people have depressed immune systems or immune systems
Right.
that are not functioning properly. So addressing that is important too. And autoimmunity doesn't mean that your immune system's too strong. It's just
Right.
imbalanced.
What would you, is there anything that you would like to say as we wrap up? Where can people find you maybe?
Sure. You can go to my website, which is drweitz.com, drweitz.com. You can call my office in Santa Monica at 310-395-3111 and make an appointment for a functional medicine consultation. Check out my Rational Wellness podcast on Apple Podcasts, Spotify, YouTube.
Awesome. Okay. Thank you for coming on.
Thank you so much, Joe.
67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping to keep us ad-free.